comment a little bit on how in your studies you measured renal function? Was it looking at glomerular filtration rate? Were you looking at creatinine clearance? Or were you just looking at whether the person, colored different colors, peed different colors? So I'd like some comments on that to help bring home some of the research that you did about protein and renal safety.
Well, I'll start. Can I have the mic? So we just completed a 15-month study, weight loss study with protein pacing in a group of overweight men and women. It was a fairly large cohort, 40 of them. And we specifically addressed that, Dr. Coleman. So what we did was we monitored kidney function. So we did a complete panel of a whole bunch of different blood variables. And from the beginning to the end, nothing fell out of range. So I can at least comment from the protein pacing model that we use in our experiments. There was no demonstrable or any detrimental negative change in kidney function as well as other blood parameters. So that was, for at least our perspective, very telling. And I know Dr. Antonio.
Yeah, I have 1-year data on basically recreational male bodybuilders showing nothing, no changes in we did a CMP, comprehensive metabolic panel as well, and nothing changed. And even their blood lipids were pretty. I mean, eating a lot of protein has no harmful effects that I've seen. Yeah, we looked at estimated GFR as well. So I can't find anything. I don't know why it's so pervasive in the, I don't know if I want to call it the literature, but it is an idea that seems rather odd that eating a high protein diet, and these guys are eating a lot, more so than probably most people would want to. There's no deleterious effects.
From a different perspective, we've looked at higher protein intake in breast cancer survivors. So the oncologists were concerned about growth hormone IGF-1 interactions with tumor growth in those studies. So we were monitored real closely by our IRB and our medical school staff, and in that particular case, it was a 12-week higher protein intake resistance training in breast cancer survivors study. And we measured IGF-1. We did not do a kidney panel on those folks. And IGF-1 did shift up, but everything was still within normal range. And so it pleased both sides in terms of muscle mass maintenance during a time when it's usually cancer cachexia, just killing muscle mass. So no problems on that side either.
Doug, just real quick, one is,
an N of 1 in myself, which probably doesn't mean much, but relative to the last probably 4 or 5 years, every time I go in for an annual physical, and my physician runs, my comprehensive panel. So my BUN level, my blood urea nitrogen level is always elevated. My liver enzymes slightly elevated, and so my creatinine levels slightly elevated, and so I had this ongoing discussion. He was like, "Oh my gosh," and I'm like, "Well, okay." I go to the gym, I grind every day. My diet is very high in protein, so even though on my panel, my GFR was fine, so trying to convince that, at least from my standpoint, that I simply eat way more protein than really what my body is utilizing. So my liver is actively involved in breaking down and transaminating and deaminating those extra amino acids from the protein load. Creatinine, okay, I've got a greater amount of muscle mass than most people, so creatine is non-enzymatically degraded, and so on and so forth. So finally, I said, "Okay, doc," I said, "I'll go in." I said, you can do an MRI scan of my liver and see if it's enlarged and all this other stuff. And I went in, and so everything checked out A-OK, at least in me, from the standpoint that, and I'm no different than a lot of you other in the room, in that we eat higher amounts of protein. And that doesn't necessarily mean that it's bad. It's just simply just an aspect of the fact that, our bodies are metabolizing extra protein. And so some people would say, yeah, but that puts extra stress on the liver. Well, maybe not so much. The liver just gets used to dealing with breaking that down, and those protein enzymes that are involved in that become upregulated because they are consistently dealing with a higher protein load to be able to do that. So it's kind of an issue of adaptation over time, not necessarily something that's, you know, responsive to a potentially pathological scenario. So, you know, anyway, even though it's an N of 1, you know,